Hello everyone, and welcome to this audio podcast in this series that excerpts Equipoise chapter. This is the Shientist, and this is another Storm Robotics production. To be highlighting an excerpt around the need to consider renal health in transfusion care and research to inform best practice. This is a retrospective. And so, in context of the excerpt around this works, the background is that an estimated of 15 million patients in the United Kingdom or England have at least one long-term condition or a chronic illness. The numbers of patients with multiple long-term conditions or chronic illnesses was set to rise from 1.9 million in 2008 to 2.9 million in 2018. Some patients cannot receive or not able to have blood transfusions, and there are no universally accepted treatment guidelines for managing care for such patients. The objective around was several. To number one, number one. The main objective was to highlight the need to consider renal health in transfusion care and research to inform best practice. And the aims around this was that number one, to understand what further aspects of care are required for patients with long-term conditions or chronic illnesses in context of transfusion practices. Number two, highlight what practices would support the development of transfusion care guidelines. And number three, to provide an understanding of treatment alternatives, taking renal insufficiency into consideration. The methodology or methods around this was 450 abstracts were identified, 274 papers were cross-examined using a critical appraisal skills program, 82 papers were evaluated to number one, understand what needs more consideration for patients with long-term conditions or chronic illnesses in context of hematology and transfusion practices and care guidelines. Practice care guidelines. Number two, what practices would help develop transfusion care guidelines, and three, provide an understanding of what present indications are required for red blood cell transfusions. The themes derived around this work was that there was a lack of renal health in transfusion care strategies for patients with chronic illnesses. Number two, managing anemia in chronically ill and transfusible patients. Number three, alternatives and indications to red blood cell transfusions. And number four, the importance of research in leadership and management. The discussion around this was studies are required to understand whether patients would benefit from transfusion replacement therapies. And the conclusion around this, scientists with transfusion care expertise should provide context on the importance of renal health. Some main terminologies around this include blood transfusion, renal health, research, leadership, management, guidelines, best practice, and red blood cells. I have a few acknowledgements in relating to this excerpt, and again, this works was it has been in part in collaboration with in related to an academic where there was an academic institution collaboration, and in collaboration with the renal patient support group, the RPSG. Once again, this audio podcast was around the need to consider renal health in transfusion care and research to inform best practice. And this was a retrospective